Men's health awareness. According to Center for Disease Control and Prevention, on an average men die 5 years earlier than women. When it comes to prevention and early detection, men's health often takes a backseat to women's health. Research shows that, compared to women, men are more likely to smoke and drink alcohol, less healthy lifestyles, and are more likely to put off routine checkups. The most common conditions affecting men are coronary artery disease, prostate cancer, depression, and diabetes. Coronary artery disease is the leading cause of death for men in India. 70 to 90% of sudden heart attacks are experienced by men. The overall prevalence of coronary artery disease is 6.2% more in men than women. Narrowing or complete blockage in coronary arteries usually caused by atherosclerosis may damage the heart muscle and will result in myocardial infarction, arrhythmias, and heart failure. Major risk factors of coronary artery disease are age, sex, family history, hypertension, hypolipidemia, diabetes mellitus, smoking, alcohol consumption, and obesity. The warning signs of coronary artery diseases may vary from person to person. In some cases, it may be asymptomatic. If not, symptoms can include angina, pain or discomfort in arms, left shoulder, neck or jaw, nausea, dizziness, cold sweats, and shortness of breath. Prostate cancer affects the prostate gland. Cancer can develop when the abnormal cells develop within the prostate gland. These cells will grow and multiply, forming a tumor that can grow to invade nearby tissues. It usually affects men in the age group of 65 and above. Recently, there has been an increase in reports of cancer in younger men in the age group of 35 to 44. However, risk of prostate cancer increases with age. In India, there is an increasing trend in the incidence of prostate cancer. Risk factors for developing prostate cancer are increasing age, family history, obesity, and eating habits. The potential warning signs of prostate cancer are painful or burning sensation during urination or ejaculation, frequent urination, particularly at night, difficulty while stopping or starting urination, sudden erectile dysfunction, and blood in urine or semen. According to experts, 1 in 5 Indian men are clinically depressed. Depression is also a significant risk factor in suicide. According to India's National Crime Records Bureau, suicide was the leading cause of death. 20% of Indian men. Depression is a common mental health problem that involves a low mood and a loss of interest in activities. In most cases, men can be reluctant to seek help for depression or other mental health issues. It can become potentially life-threatening. Risk factors that may increase the risk of developing depression are stressful change in life patterns, low socioeconomic status, use of alcohol or drugs, employment problems, etc. The major symptoms of depression may include difficulty sleeping or sleeping too much, change in appetite, feelings of hopelessness or worthlessness, excessive sadness or feelings of emptiness, and thoughts of suicide or self-harm. Diabetes describes the conditions where the body fails to maintain a healthy level of glucose in the blood. In India, over 30 million have now been diagnosed with diabetes and is more common in males than females. The male-to-female ratio for diabetes in the Indian population is 2 to 1. Diabetes is the single most important risk factor for cardiovascular disease. Type 1 diabetes is associated with genes and environmental factors. Type 2 diabetes is often lifestyle-related. Lifestyle risk factors are obesity, physical inactivity, smoking, and unhealthy diet. The lack of blood sugar control can trigger a range of symptoms which include polyuria, polydipsia, polyphagia, weight loss, and loss of muscle bulk. Many of the major health risks that men face can be prevented with a healthy lifestyle. Healthy lifestyle can be promoted by regular exercise, healthy diet, stay away from drugs, smoking and alcohol, routine medical care and physical examinations, regular screenings for prostate and colon cancer, and by keeping yourself mentally active.